Place the patient in the supine position. Adjust the height of the bed. Remove pillows and objects used for positioning the patient. Lower completely the head of the bed, or as far as the patient will tolerate. Place the patient on his or her back. Position a pillow under the patient's upper shoulders, neck, and head. Place rollers on the outer sides, hips, and ankles. Place a pillow under the patient's lower limbs to elevate the heels. Support the patient's feet on a firm pillow. Place the patient's forearms in a pronated position with pillows. Keep the patient's arms parallel to the body. Place rollers in the patient's hands. Place the patient in the semi-Fowler position. Adjust the height of the bed with respect to body mechanics. Remove pillows and objects used to position the patient. Elevate the head of the bed to a 30 to 45 degree angle. Place the patient in a seating position as straight as possible. Rest the patient's head on a small pillow. Slightly bend the patient's chin forward. Support the patient's arms, elbows, and hands by resting them on pillows. Place the patient's affected hand or hands in a gripping position. Bend the patient's knees and legs and support them with a pillow. Keep the feet dorsiflexed with a firm pillow. Place the patient in the lateral decubitus position. Adjust the height of the bed with respect to body mechanics. Remove pillows and objects used for positioning the patient. Stand on the side of the bed opposite the one to which the patient will be facing. Lower the head of the bed completely, considering the patient's tolerance. Place yourself on the opposite side of the bed. Lower the side rail. Position the patient's head towards you. Cross the patient's arms on the thorax. Place a pillow under the patient's head and neck. Turn the patient towards you according to body mechanics, using a dive or a draw sheet if required. Support the patient's upper arm in flexion on a pillow. Let the patient's other arm rest on the mattress. Place a pillow under the patient's back. Keep the patient's upper leg half flexed and rested on a pillow. Support the patient's feet by placing a sandbag parallel to the plantar surface. Place the patient in the Sims position. Adjust the height of the bed with respect to body mechanics. Remove pillows and objects used for positioning the patient. Lower the head of the bed completely, or as far as the patient will tolerate. Place the patient in a lateral position, partially lying on his or her stomach. Place a small pillow under the patient's head. Place a pillow under the patient's slightly bent forearm. Place a pillow under the patient's slightly bent upper leg. Support the patient's feet by placing a sandbag parallel to the plantar surface. Perform concluding steps common to procedures. This capsule has provided instructions for placing patients in 4 different bed positions.